The Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
And he can't urinate last night. Then, from the history, we found that he had the difficulty to pass the urine. He felt he cannot empty his bladder. He woke up every 4 or 5 times in the night to urinate. The last night, he drank some alcohol, some beer, and then he started to can't urinate. Then I have to insert the tube to drain the urine out from his bladder. And after that, we discussed together what we would like to do. He needs to do the prostate operation. That's why I am here. Today, I would like to talk to you about I would like to talk to you about how to your water work at your age and what we can do about that. Okay, we start with have anybody has the problem with the bladder or problem with the stream was not too strong. Has anyone have that? I think almost everyone. Okay. Then some of my patients, they have to find out the toilet when they go traveling, or maybe they have to worry that when go to the public place, they're gonna leak and can wet on your pants. These symptoms, it should be the prostate problem. Then today I would like to start with what is the prostate. The prostate gland is the organ is only have in the men. It's hiding in the pelvis. You cannot take a look from the outside. The prostate is surround the urethra or the pipe system below the bladder. What is the function? The function of the prostate is to produce the fluid for the sperm and can make the sperm alive. When you get older, more than 40 years, we know that the prostate is grow up. And 50% of the people over 50 years old have the prostate problem. 60% over 60 years old. 70% over 70 years old. And 80% over 80 years old. You will gonna have the prostate problem. Most of the people, most of the men, you got this problem for sure. When the prostate is grow up, I will show you the picture. This is the prostate. This is we call the urethra or the pipe system, and this is the bladder. When the prostate is grow up, it have the pressure and it squeeze the urethra or your pipe system. Make your flow of the urine was not good, and after that, you cannot empty the bladder. In the case, if you have this problem for a long time, your bladder it should not good function anymore in the long term. Today, I would like to talk the prostate enlargement as the BPH. The BPH is mean the benign prostatic hyperplasia. What is the BPH symptom? The BPH symptom that maybe you have the urinary frequency. Some patients maybe have to wake up many times in the night to urinate. Sometimes you feel that you have the urgency, have to rush to the toilet, or maybe difficult to start the urination. Some patients maybe have the weak of the urine flow, and always sometimes some patients maybe have the urinary tract infections. And that's why the patients come to see the doctor. If you have these all of the symptoms, you have to talk with your doctor. what's going on. When you talk with your doctor, the doctor will ask you some questions. Your history, your medical history, like you have the hypertension, you have the heart disease, you have the diabetes, or even your own medications that we have to know also. The last one, we have to know that what is the previous operation that you had before, to giving us all of the information. Then this is the most important part, that is the digital rectal examinations. The doctor will do that because they would like to know the information about the how prostate size do you have, and the most important that we can detect the nodule or the lump in the prostate that can represent the prostate cancer. Anyway, I have the small fingers. My patient is gonna have no pain when I do that, okay? The next step, we have to check the urine. The urine can show about the infections or the blood in the urine. That if you have the infections, it means that the prostate may be getting worse in the future. The next step, we check the blood test for the PSA. The PSA is the prostatic specific antigen. Is the blood test screening for the prostate. But for the PSA, it doesn't tell you that you have the prostate cancer or not. It's just for the screening about the prostate cancer. Sometimes we have to do the ultrasound or X-ray. The ultrasound that we do on the kidney, on the bladder, and the prostate area. The most important of this part, that we have to find out another cause of your bladder problem. Some patients maybe have the stone, have the tumor, that make you have the bladder problem also. Anyway, we can make sure about the prostate size that you have from the ultrasound. The last test is the important part also. We call the uroflowmetry. The uroflowmetry is for make sure how much stone of the urine that you have. It tells us about the quality of your urinations. That's the important part. Anyway, if you know that you have the Bph symptoms, you do the test, we have all of the information and diagnose you are the Bph patients. The first, we have to discuss and talk to you. The first step we have to do, we call the lifestyle modifications. It means that you have to drink less water after dinner. Sometimes you have to avoid to drink coffee, tea, or any alcohol. Anyway, some patients do like that, but still have the problem. Then, for the Bph treatment, we have the 3 options to do. The first, we try medications. Second option, we try the prostate surgery is the standard one that I will show you in the next slide. And the third is the alternative treatment that today is about the water vapor therapy that I will talk to you. For the medications, we have the 2 kinds of the medications. The first one, the medication for relax the prostate muscle and relieve the pressure in the bladder. For that medication, the flow of the urine is getting better and you can empty more your bladder. The second medication is for shrink or reduce the prostate volume. We found that with that medication is reduced 20%. If you're getting better with the medications, you have to take that medication lifelong. As we know that the medications is have the cost. The medications is have the side effect. What kind of the side effect? Most of the case is impact your sexual life. The first is decrease your libido. The second is decrease your erection function. And the third, after you took the medication, the sperm is not going out. That's the most common side effect that we found from the medications. If you take the medications and it's not getting better at all, the doctor in the past, we talked to you about the prostate operation. What is the prostate operation? The prostate operation we call the TURP or TURP is the gold standard surgery for the prostate that we do for more than 20 years. For the TURP surgery, it means that we have to put the camera in the penis. And this is the prostate. We have to remove some prostate tissue, more than 50% of the prostate. Make like you have the big hole inside. After that, you can pass the urine through this hole. We know that it's a very good outcome. I do the TURP surgery for over 15 years, and almost of the cases have very good outcome. But half of my patients, they're still sexually active. They're coming back and complain to me why his sexual life is not same anymore. Because the TURP or the TURP is affect about your erections. Some of the cases have that. But the most important thing that when you do the TURP surgery, the sperm is not go outside anymore. It's go back in your bladder. We call retrograde ejaculation. How much percent that we found? More than 80%. More than 80%. And that's why half of my patients is complain about that after this surgery. Then I try to find the alternative treatment that maybe we can do something before we do the TURP or not. That's why I am here. Because today we found that we have the alternative treatment that we call the water vapor therapy. The water vapor therapy means that we have to reduce the prostate size by we inject the hot vapor in the prostate, make the prostate cell to be dead and shrink after that. This is the instrument that we use. On the tip of the instrument, they have the needle, and the needle they have around 12 holes to inject the vapor, hot vapor in the prostate tissue. The next video, I will show you how the water vapor therapy works for you.
Resume uses the natural energy stored in water vapor, or steam. It is a safe and effective treatment available to relieve symptoms associated with benign prostatic hyperplasia, or BPH. During each 9-second treatment, sterile water vapor is released throughout the targeted prostate tissue. When the steam turns back into water, all the stored energy is released, causing the cells to die. Over time, your body's natural healing response removes the dead cells, shrinking the prostate. With the extra tissue removed, the urethra opens, reducing BPH symptoms. Most patients begin to experience symptom relief in as soon as 2 weeks, and maximum benefit will occur within 3 months. Resume use.
Then, for the water vapor therapy treatment, we have to insert the instrument and the camera in the urethra or the pipe system. On the tip of the instrument, they have the needle. The needle will be deployed in the prostate tissue, and we have to inject the hot vapor at 103 degrees Celsius. Each 9 seconds is injection site. After that, we found that when the hot vapor goes to the prostate cell, it can make the prostate cell to be dead immediately. After that, your body is natural to absorb the cell death by yourself after 2 weeks, and the maximum effect is within 3 months. For this technology, it takes time maybe around 15 to 20 minutes. And we can do under like giving you the medicine for sleeping and the painkiller, like you do the colonoscopy or gastroscopy. We call the sedation. Don't need the general anesthesia or the spinal anesthesia. The patients don't have to stay overnight in the hospital. We do like the outpatients, stay in the recovery room around 2 to 6 hours and go home on the same day. It has the less bleeding, less complications, and the most important things of this technique is preserve your sexual functions. This is the picture to show that when I do the water vapor therapy, I have to measure the length of the prostate you have, and I have to decide how many treatments that you need. Normally, you need around 4 to 6 treatments that is can cover all of the area of the prostate. But anyway, when we put the hot water inside, the prostate cell was swelling, and this is the only one problem of this technique, because you could not urinate in 1 or 2 days. What I can do? I have to insert the tube or the catheter in the bladder to make it relax, and you will have the tube and the bag, small bag on your leg for 5 to 7 days. We know that maybe it's inconvenient, it's irritating on your penis, but most of my cases take the painkiller only 1 or 2 pills after the operation, and you can do like your normal activities. You can walk, you can driving, you can go shopping. Only some limitations like exercise you cannot do, swimming you cannot do, and having sex also. This slide I will show that how they can reduce the prostate. This picture is show the prostate is over here and it's like a blocking on this area. After the patients do the water vapor treatment, 13 treatment, after that at 6 months time, we found that the prostate tissue on this area is gone, and the lumen is opened up again. Then I will show you that the vapor treatment can reduce your prostate gland by the volume and the obstruction also. Why the water vapor therapy? We know that the water vapor therapy is the minimally invasive surgery. It's less complications. It's less side effect. We can preserve your sexual functions. As I told you before, for the TURP surgery, you will have the sexual dysfunction or ejaculation problem more than 80%. For the water vapor therapy, we found less than 6%. It's quick and simple. Take time just 15 to 20 minutes to do. And we can do like the outpatient. And the most important thing that if the patients have the high risk for the anesthesia, like you have the heart problem, you take the blood pressure medication, heart medications, or diabetes, we still can do with the water vapor therapy also. Because we don't have to do like a general anesthesia. We're just giving you the medicine for sedations that we use for some high-risk patients. Then the water vapor therapy have many researches, and it has been approved by the FDA US in 2015 and FDA Thailand in 2021. That is proof that the water vapor therapy has a good efficacy and is safety for the BPH patient. The next slide, I will show one of my patients who has been done with the water vapor therapy, and now it's 6 months time already. He was very satisfied with this treatment.
Okay, my name is Rolf Hitz. I'm a Swiss man. I stay here in Thailand now 7 years. Stay in Bang Sang. The new technology from Retsum I heard the first time from Dr Niti. He told me, and he asked me then, because he told me at the beginning to take this medicine Duodart, which is very expensive. In 3 months it costs about £9,800. So it's in 1 year about 40,000. So he told when you make the operation it will cost about $1,000,000. So you still can save some money also and not need to take every day then the medicine. As I told, after the surgery, this rhythm system, I had some pain on the penis with from the catheter. But after the catheter out, then I had some small problems. But I have to go for urinate for many times, and always only a little bit. And in the night go up 2 times for PP. But after 2-3 weeks, it was going more and more better. And also the flow was much better. And after the last test we made here 2 weeks back, the flow test was very good also. When some people would ask me, they would tell, make it. It's you have a better life later on, and you not need to take medicine, and you can save money also, of course. I would always I would do it again, of course, no problem.
Okay, then right now, if you have the Bph symptoms, you will know that you have the 3 options to do. The first, I prefer you to start with the medication anyway. But if you start the medications and it won't work, or you have the side effect with the medication, or you don't want to take the medications for lifelong, the second option that I will recommend for you is the water vapor therapy. We have the experience about that more than 40 cases, and we found that more than 90% my patient is very satisfied on that treatment, and most important, all of my patients can stop the medications. Then, in my opinion, I think if you have the prostate problem, or you're not sure you have or have not, you have to talk with your doctors, and we will give you more information. Thank you very much. Thank you.
Okay, we have some questions here.
I have a question. You mentioned 2 medications. One of them was a muscle relaxant, I think. What do you normally use?
The normally we call the alpha blocker. The alpha blocker have many medicine, but the mechanism is for relax the prostate muscles, not all of muscle in your body, just the specific on the prostate muscle.
Okay, thank you.
Yes, this treatment you're speaking about, is it permanent, or has it only got a 1-year lifetime, so to speak?
Thank you very much for your questions. This treatment is lifelong for maybe 5 to 7 years, but you will know that the prostate gland is grow up by the aging. Then in the future, the prostate is going to grow up also. Anyway, when we compare with the gold standard treatment, the TURP surgery. The TURP surgery we talk about the 10 years that you don't have to do anything. But after the 10 years, maybe you have to start with the medication. For the water vapor treatment, we talk about 5 to 7 years.
Can you tell me the difference between the water vapor therapy and the green laser therapy?
The green light laser is we have that for 10 years already for the green light laser, and I did also. Anyway, for the green light laser, the mechanism is the same that the TURP did, and it's the one kind of surgery. You will have the big hole inside, you will have the side effect, you have the complications. But the water vapor therapy is a different mechanism. It's no incision, it's no wound, and it can treat your prostate.
Doctor, thank you very much. Very interesting. Can you tell us, with the water vapor therapy, what the reduction in size of an enlarged prostate is? Pre-therapy, obviously, post-therapy.
Yes, sir. When we talk about the prostate size, when we make sure about the prostate size, the prostate is like the ball. We make sure the outer cortex of the prostate. But the most important that the inner part of the prostate that make you have the problem. That what is the goal of the water vapor therapy is for reduce the prostate in the inner part of the prostate gland to open up the ureter for you. But anyway, from the research, we found that it can reduce the prostate volume around 35 to 40% of the prostate volume.
After 5 to 7 years, can the water vapor treatment be repeated?
Yes, sir. After 5 to 7 years, if you're gonna have the problem, maybe you should start with the medication again. But if you ask me, you can repeat the water vapor therapy. You can do. It's possible to repeat one more time.
During the operation, how is the needle inserted? Inserted through the groin or otherwise?
I have to insert the instrument in your penis. Yes, sir. And the tip of the instrument, they have the needle. We deploy direct in the prostate. I can see the needle in the prostate for you.
Is it painful?
No, you sleeping. You didn't feel anything when we do that.
Okay. Hello? Okay.
I've been taking a medication for maybe 10 years ago, the tamsulosin, and this has the same effect with ejaculation, just from back inside. Is it easier to change that medication? Because I find initially it was okay, but now I'm back to what I was many years back.
You mean that you have to change the medication or not?
Is it possible to change the medication? Perhaps that'll have an effect, but I haven't got to get up in the night regularly.
The medication and in this group is the same mechanism, and most of the medicine is have the side effect about the ejaculation. But anyway, it's individual also. If you try to change the medication, you will know how it works for you. If you ask me, you can try to change 1 or 2 more times. It's possible.
Mine is a question of, will a vasectomy affect your prostate? And if your testosterone has gone very low, you're underneath a steroid treatment?
We found that about the sex is not have the direct effect to the prostate. Anyway, when you have the low level of the testosterone hormone, your prostate is like you not have the food for the prostate. The prostate is a little bit shrink than the normal. Then when we giving you the hormone treatment, the prostate is get back to the normal that you had before.
Yes, I've been a patient of Dr. Niti's for the last 3 months. And to give you some background, I'm 82 years old. When I was 70, I decided to stop getting the prostate examination. This was based on a personal decision that my physician in California was a doctor, young doctor, a woman that I knew well, and she also had very large hands and fingers. So to save myself some embarrassment and looking into it, I came to the conclusion that after 70, the chances of dying from prostate cancer was very, very low. So, right or wrong, that's the decision I made. Now, a couple of years ago, I started having some prostate problems, and I decided to just ignore them. Came up to about a month and a half ago, 2 months, it became very uncomfortable. I knew I had to get some kind of looking into, but again, I was hesitant. And I read online about the new treatment and about Dr. Niti. Found out that he was, at that time, I think only one of the 2 doctors in all of Thailand that could do the water vapor treatment. So I thought, worst case scenario, I'll go in, I'll get the water treatment, and I'll go home. Unfortunately, the lesson learned there was I had waited too long. And when I went into him, my prostate was, I believe, 100 centimeters.
If I remember, I think it's over 120.
Well, over 120. The news that it was also infected, so I had an infected prostate that was over 120. And unfortunately, because I had made this error, the water treatment was not available, and I had to have prostate surgery. So we scheduled it. It went in. I knew there was going to be after effects, but Dr. Niti stayed with me the whole time. First was urination, and he taught me an exercise that took care of that, so I don't have that problem anymore. Repeated infection that he addressed, and strangely enough, the sexually side improved after the surgery. So I attribute that to reducing probably the size of the prostate on everything else. But my lesson learned, and this is what I'm telling my friends, a lot of you in here are around, younger than me, or about the same age, and you may also make the decision of not getting that yearly examination, not necessary. Trust me, it is necessary. It may be unpleasant, but you could save yourself a lot of pain and expense by going through that once-a-year examination and having it over with. And I want to thank you, Dr. Niti, for your kind attention to my subject and also for taking such great care of me.
Thank you very much, sir.
As an outpatient, I would like to know what the cost of the water vapor treatment is.
Yeah, I prepare myself to answer this question because there's no more than people would like to know the cost of the surgery. Can you hear me? Okay, because you told me the side that you could not hear me well. Okay, the cost of the surgery is 200,000 baht. Normally, the procedure cost is only for the operations, but today I'm gonna offer the special price, which include all the 9 numbers that you could see on the screen. The number 9 is the complimentary for the P operations, which value about 12,000 baht, but I can only offer for the first 10 patients. Mention that we are from the PCEC meeting today. As you may notice that before you are going to have the surgery, you could have the P operation to make sure that you are fit before the operation and be safe. So this one normally is extra, you have to pay extra. But the price that I could offer you today is inclusive of the 3 months follow-up, the home medication, the surgery, and the pre-operations. If you would like to get this offer, you can send me an email, you can contact the hospital, you can get the doctor name card that you can send email directly to him. So before we are going to discuss about the surgery, that if you would like to have it or not, or you are the criteria that you need the surgery,